Welcome back to the Psycho Nurse, the space where we break down medical mysteries, psychological phenomena, and the science behind the human body in a way that is clear, evidence-based, and clinically grounded. Today, we are exploring a topic that scares patients, families, and even healthcare professionals: diseases that cause paralysis. I'm not talking about the dramatic, instant paralysis you see in movies. I'm talking about the real medical conditions, some rapid, some slow, some reversible, and some permanent that can rob the body of movement. To understand these diseases, we first need to understand what paralysis actually is. Think of your nervous system as a complex communication network. Your brain is the command center that sends the orders. The spinal cord is the superhighway that carries the messages. The peripheral nerves are the local roads that deliver the signals directly to your muscles. And finally, the muscles execute the action. Paralysis happens when this chain of command is disrupted at any point. The problem could be in the brain, the spinal cord, the peripheral nerves, or even at the tiny junction where nerves meet muscle fibers. So let's break down the major diseases and conditions that can cause paralysis, understand how they work, see what symptoms nurses and doctors are trained to watch for, and explore what treatments exist today. First up is Guillain-Barré Syndrome, or GBS. This is one of the most dramatic and frightening neurological conditions because it can strike a perfectly healthy person out of the blue. In GBS, the body's own immune system makes a terrible mistake and starts attacking the protective myelin sheath that surrounds our peripheral nerves. Imagine stripping the insulation off electrical wires so signals just can't get through properly. It typically begins with a strange tingling or numbness in the feet and hands. From there, a progressive weakness spreads upward, moving from the legs to the torso, then to the arms and face. This can happen incredibly fast, sometimes within hours. As nurses, we are on high alert for specific signs: a loss of deep tendon reflexes, difficulty walking, facial weakness or drooping, and trouble speaking. But the most critical thing we monitor is breathing. GBS can paralyze the diaphragm, the primary muscle for respiration, leading to respiratory failure. This is a medical emergency, and many patients need to be admitted to the ICU and placed on a ventilator temporarily to help them breathe. Treatment usually involves therapies like intravenous immunoglobulin or ice, which provides healthy antibodies to help calm the immune system's attack, or plasma, a procedure that cleans the patient's blood to remove the harmful antibodies. The good news is that most people with GBS do recover, although the road to recovery can be long, often taking months of intensive physical therapy. Next, let's discuss amyotrophic lateral sclerosis, better known as ALS. Unlike GBS, ALS is a progressive and irreversible disease. It specifically targets and destroys motor neurons, the nerve cells responsible for controlling voluntary muscle movement. As these neurons die, the brain's commands can no longer reach the muscles. The early symptoms can be subtle, like muscle twitching, a growing weakness in the hands or legs, or slight changes in speech or swallowing. Over time, however, the paralysis spreads relentlessly until patients lose the ability to move, speak, or even breathe on their own. The role of nursing in ALS care is multifaceted. We focus on critical respiratory monitoring, helping patients adapt to mobility devices like wheelchairs, managing their nutrition as swallowing becomes more difficult, and providing crucial emotional support for both the patient and their family as they navigate this incredibly challenging journey. Now, let's talk about a very common cause of paralysis: a stroke. A stroke occurs when the blood supply to a part of the brain is either blocked by a clot or when a blood vessel in the brain bursts and causes bleeding. Different areas of your brain control different parts of your body, so the symptoms of a stroke depend entirely on where the damage occurs. A hallmark sign is paralysis that affects one side of the body, a sudden inability to move an arm, a leg, or the entire right or left side. You've probably heard of the FAST acronym, and it's a vital tool for quick assessment. F is for face drooping. Ask the person to smile and see if one side sags. A is for arm weakness. Ask them to raise both arms and see if one drifts downward. S is for speech difficulty. Listen for slurred or strange speech. And T is for time to call emergency services immediately. With a stroke, every single minute counts. The longer the brain is deprived of blood, the more brain cells die. In the hospital, nurses play a key role in rapidly identifying stroke symptoms, constantly monitoring vital signs, and assisting with acute interventions like clot-busting medications or surgical procedures to remove the blockage. Another major cause is a spinal cord injury. Trauma is one of the most well-known reasons for paralysis. Things like car accidents, serious falls, violent acts, or sports injuries can sever or compress the spinal cord, permanently disrupting the flow of information between the brain and the body below the injury site. The level of the injury on the spinal cord determines the extent of the paralysis. An injury high up in the neck, in the cervical spine, can lead to quadriplegia, which is paralysis of all four limbs. An injury lower down in the thoracic or lumbar region to the back typically results in paraplegia, which is paralysis of the legs. For nurses in trauma units, the initial focus is on stabilizing the patient. This involves protecting the airway, immobilizing the spine to prevent further damage, managing blood pressure, and preventing skin breakdown. Just as important is providing immediate emotional support as patients and their families begin to process the life-altering reality of their new condition. Let's move on to multiple sclerosis, or MS. MS is an autoimmune disease where the immune system attacks the myelin sheath of nerves, but this time it's in the central nervous system, the brain and spinal cord. Unlike the other conditions, MS is often characterized by periods of flare-ups, also called relapses and remissions. During a flare-up, inflammation can cause a wide range of symptoms, including weakness, numbness, vision problems, balance issues, and even partial or temporary paralysis. Many patients can regain a lot of their function after a flare-up is treated with steroids or with long-term disease-modifying therapies. For nurses, MS care is about helping patients manage their chronic symptoms, like debilitating fatigue, preventing falls, educating them on complex medication regimens, and supporting them in maintaining as much mobility and independence as possible. A less common but serious condition is transverse myelitis. This is a sudden inflammation of the spinal cord that can seemingly appear out of nowhere, even in healthy people. It can be triggered by an infection or an autoimmune response. The symptoms can develop rapidly over hours or days and include sudden weakness in the legs, a loss of sensation, severe back pain, and a loss of bladder and bowel control. The paralysis can progress very quickly. Treatment is aimed at reducing the inflammation and often involves high-dose steroids, plasmapheresis, and intensive rehabilitation. Nurses on the floor must monitor neurological changes meticulously and help manage bladder, bowel, and mobility challenges. Have you ever heard of botulism? It's a rare but serious illness caused by a toxin produced by bacteria. This toxin is one of the most potent poisons known to science, and it works by blocking nerve signals from reaching the muscles. Unlike GBS, which typically causes an ascending paralysis from the feet up, botulism causes a descending paralysis. The symptoms start at the top and move down Daba Vijan, drooping eyelids, facial paralysis, difficulty swallowing, and then progressive weakness that can lead to respiratory failure. Nurses must monitor breathing with extreme care and be ready for emergency respiratory support. The key to treatment is the early administration of a specific antitoxin, which can halt the progression and improve recovery. Next is Myasthenia gravis, another autoimmune disease. In this condition, the immune system specifically attacks the connection point between nerves and muscles, called the neuromuscular junction. This disrupts communication and leads to muscle weakness. Classic symptoms include drooping eyelids, facial weakness, and difficulty swallowing or speaking. A hallmark of myasthenia gravis is that the muscle weakness gets worse with activity and improves with rest. A patient might feel fine in the morning but become progressively weaker throughout the day. A severe flare-up, called a myasthenic crisis, can lead to respiratory failure. Nurses are responsible for administering medications that help improve nerve-muscle communication, monitoring respiratory status, ensuring safe swallowing to prevent aspiration, and watching carefully for signs of overmedication, which can paradoxically cause a different kind of crisis. Of course, we can't talk about paralysis without mentioning polio. This viral infection specifically targets and destroys motor neurons, leading to limb weakness, sudden paralysis, and difficulty breathing. Thanks to global vaccination efforts, polio has been nearly eradicated, but outbreaks unfortunately still occur in some parts of the world. For this disease, the role of healthcare professionals, especially nurses, is heavily focused on education, prevention, and promoting vaccination awareness. It's a powerful reminder of how public health measures can conquer devastating diseases. Finally, here's a surprising one: tick paralysis. This is not an infection, but a reaction to a neurotoxin found in the saliva of certain species of ticks. As the tick feeds, it injects the toxin, causing a rapidly progressing paralysis. Symptoms often start with leg weakness and an unsteady gait, which can escalate to full-body paralysis within a day or two. Guillain-Barré. The cure is simple but extremely time-sensitive. Find and remove the tick. Once the source of the toxin is gone, symptoms often begin to reverse within hours, 2 days. It's a critical reminder to always check for ticks after spending time outdoors. So, as you can see, paralysis is one of the most dramatic symptoms in medicine, with a vast range of causes. Some are reversible, some are progressive, some are preventable, and some require immediate life-saving intervention. The key to saving lives and preserving function is recognizing the early warning signs: sudden weakness, a loss of sensation, facial drooping, difficulty speaking or swallowing, rapid fatigue, or any trouble breathing. As nurses, we are trained to detect these subtle changes, often long before full paralysis sets in. And for everyone watching, understanding these diseases empowers you to seek care early for yourself or a loved one and to take control of your health. If you found this deep dive informative, make sure to subscribe to The Psycho Nurse for more science-backed psychology-informed medical content every week. Thanks for watching.